Dr. Javed Akram is the president of the Pakistan Society of Internal Medicine and joins us from Lahore. Good to have you, doctor. You know, it's been striking as the world watches these pictures. Of course, the immediate need is, getting people to some kind of shelter. But there's this growing fear of diseases that will come out of this. What's most striking to you about what you are seeing?
Thank you so much for having me on the show. I think it's one of the worst crises that we in Pakistan have faced over the last 74 years. Um, Flooding has affected the rural areas more than the developed areas, and also I think the floods, especially in our Sindh province and Balochistan, and to some extent in north of Punjab province and KPK. Uh, it has affected the public health system. That means the whole infrastructure of water supply, sanitation, and also the electricity, which are the essentials for any healthy living.
Yeah.
So people are forced right now to drink flooded, contaminated water without any provision of proper hygienic toilets. So they are facing a lot of health crisis in the form of food shortages, water shortages, and also gastroenteritis. Especially in the children, not only they are suffering, but they are dying of it. And the skin diseases are rampant, and so are different fevers like dengue, which is due to stagnant water over here, and also to some extent malaria now cropping up very fast. Already it is endemic here, but now it is gone. And since people are living in very closed communities, very few houses are left, so they are living in crowded situations. So communicable lung diseases like tuberculosis, which are very much prevalent in Pakistan, and the pneumonias, they are really taking a lot of death toll in Pakistan, and a lot of people are suffering from them, and some are dying. Already, about 2,000 people have lost their lives after the directly because of the flooding. And now the main problem is the shelter and toileting and the water supply, and the food security is also quite common now in Pakistan.
So some of these illnesses that you've mentioned, these aren't just feared for happening in the aftermath of this flooding. They are already happening now and spreading.
Yes, I am there in the flood area called, it's south of Punjab, near Dera Ghazi Khan, and we are already seeing increase in hospitalizations, whether they are tertiary care or primary care setups. And I think about uh, 50 to 60% of the children living there, they are now having some form of health problem, the skin or respiratory problem or gastrointestinal problem, diarrheas and things like that. And in the adult population, because in Pakistan we are facing dual burden of disease, the diabetes, hypertension, heart disease, and stroke in the middle-aged and beyond, and also the communicable diseases. So in the because of we have 50% of the people suffering from hypertension, and the access to medicine is almost negligible now. So the chronic diseases that they were taking their medication now, there is a problem with the compliance because of the availability of medicine. So we are having the complications from hypertension like strokes. We are seeing about twice as much strokes and heart attacks as we used to see before. So it's a very complex situation, and I think it is not just a local but a crisis, but a humanitarian crisis at the national level. And we are looking for countries to help us with food shortages, with housing, and with medications, and also with the infrastructure rebuild. Now, almost we are over the rescue and problem, but now we are into the rehabilitation mode, which is much difficult, much more costlier, and much more time consuming, and needs much more resources.
Doctor, thanks so much for sharing your expertise with us. I appreciate your joining us.
Well.